RobertsYUniverse.
You're welcome.
I'm very excited to be actually recording with you here in Sacramento.
Yeah.
It's my first time here. How long have you been in Sacramento?
So I live just about 20 minutes, from here, maybe 30 minutes away in Davis. But
Okay.
I lived in Davis currently for about 10 years. I went to school here also, but then I took a big break and came back.
Oh, okay.
So a total of about 18 years, but with a 14-ish year gap in the middle.
Oh, really? Okay, great. So for my audience who don't know who you are, could you kindly introduce yourself?
Yep. So I'm Ilana Halperin. I'm a veterinarian. Okay. I graduated from UC Davis in 2003. I then went on to do a rotating internship in small animal medicine and surgery, and then practiced in general practice for about 10 years. Did some emergency work as well as in-home euthanasia for about another 3-ish years, and then got the job at UC Davis in our primary care service. So I'm associate professor of primary care there.
Wow.
Yep. And
That's a lot of titles.
I know. It's a lot, and there's more. Yeah.
I know. I'd love to learn.
Yeah. So I think it was 2007, I got certified in veterinary acupuncture.
Oh, acupuncture, even for vets, pets.
Yeah. We have veterinary acupuncture.
Okay.
So I just wanted more modalities to help treat.
Sure.
Especially for patients who either their owners weren't comfortable using some of the more typical Western medication, or their pets weren't responding as well.
Okay.
So it just gives me more options. I don't use it, honestly, in the position I have now at Davis.
Sure. Okay.
We have a whole service that takes care of that. So I was able to focus in more.
But there is a department, an acupuncture department at UC Davis.
It's our sports medicine and rehab, but they do acupuncture and physical therapy, rehab, all that kind of stuff there.
So before you were at Davis, that you told me that you were in private practice, right?
Yep.
So you must have used acupuncture back then, right?
I did. Mm-hmm.
Oh, okay, cool.
Cats, dogs, and horses, and about 2 reptiles or patients.
Really?
Yeah.
Reptiles being turtles, or?
One was a little bearded dragon.
Okay.
And the other, because I'm not a reptile vet, I don't remember exactly the type of reptile, but a little black lizard about 1 foot long.
Oh, wow.
Yeah. She was cute.
I see.
Yeah.
And any other additional titles or responsibilities at UC Davis?
Yeah, I kept going. So in 2020, I became a diplomat of the American Board of Veterinary Practitioners.
What's that?
Yeah, so if you're a general practitioner like me, so I'm in primary care, I'm sort of your first stop as a pet owner. And then if you need a specialist, we'll refer you on to whatever you need, ophthalmology, dermatology, whatever. If you want to take that primary care education a little bit farther, American Board of Veterinary Practitioners is one way to do that. I have sort of advanced my education and really confirmed and expanded on some of the knowledge that we learn in our 4 years of veterinary school.
Oh, wow. What drives you to kind of learn more? I mean, isn't it time consuming to kind of see all your patients and then, also furthering your education?
Absolutely. Yeah. Very time consuming. So
you just like to, burden yourself that way.
Yeah, it's just like a challenge.
Okay.
I think some of it is, I do like a challenge, honestly, after you've been doing something for X number of years. In my case, at that point, it had been about 17 years, I think I'd been a vet. So it was in 2020, and I graduated in 2003. I started working towards it a couple years before, because it's a long process. But after a while of doing your job, I think you hit a point sometimes, depending on your personality, where you just want a little more.
Sure.
And whether that means getting an additional degree or taking on more responsibilities or switching fields. I didn't want to switch fields. I love what I do, but I just wanted a little more, or a challenge or a change, I think.
Wow.
Working for UC Davis sort of automatically gave me that, because now I'm teaching, and teaching is, for me, a constant learning curve.
Sure.
And medicine, honestly, is a constant learning curve.
That is actually very true.
Yeah, everyone's body responds differently. It's not always as expected. But this ABVP was a way to sort of dive in and have a more structured learning process, and then have an outcome at the end.
And you're a feline specialist too.
So
that's what I saw on your resume.
Yeah. So the ABVP certification is Canine and Feline Practice. So there is a feline only. I chose to do canine and feline. I practice on both dogs and cats, but I do have a special interest in feline medicine. I love cats. I love the differences that make them cats and not dogs.
Sure.
I sort of feel like they're a little bit of the underdog, although
cats are underdogs.
Cats,
yes.
They wouldn't like me saying that. But a lot of our medicine is geared towards dogs, or a lot of our products are geared towards dogs and don't always work the same way in cats. So they have their own needs. They sometimes don't respond to the medications that we have for dogs or for people, and now I think they're getting a little more of their due credit, but historically people don't bring their cats to the vet at the same, rate that they bring their dogs in. I'll see someone's dog for years and then they suddenly mention they have a cat at home and it's like, well, you never bring the kitty in. But
I was also told that cats get stressed out by coming to the clinic with the dogs there too. I mean, they're always stressed out going to a clinic, but on top of that, there's other dogs at the clinic is always sometimes a little tricky, and that's why. Yeah. Do you agree with that?
Oh, absolutely. Okay. Yeah, it's pretty nightmarish if you're a cat, and they're mesopredators, right? So they're predators, but they're also prey. So they're not feeling at the top of the food chain at all when you bring them into the vet, and you're sitting in the lobby.
Okay.
Yeah, and you might have a big dog coming and sniffing the cat carrier or whatever walking by. So that's all intended to make the whole experience less stressful for cats, which is better medically, better for the clients, and people feel horrible when their cat is, miserable. And sometimes we can't do a good job if the cat is super defensive.
That's true.
We can't finish our exam if the cat's freaking out. Or getting an accurate blood pressure. So it does really help if you have a clinic that's set up with the cat's needs in mind.
Was your mom or your mother or father a vet, or
no?
What did they do? Did they influence you in deciding to be a vet, or?
Yes and no. They encouraged me in whatever I wanted to do. So I think I'm lucky in that my parents just had faith that, if you want to be a vet, you can be a vet. We'll help you figure out how to be a vet. Neither of them were vets. My mom was a college professor. She taught French. And my father worked for the state. And he was a lawyer. So nothing at all in medicine or animal care, but just from as long back as I can remember, I loved animals. And as soon as I started going to school, I loved science. And I always just, when they asked little kids in kindergarten, what do you want to be when you grow up? It was always vet, 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 vet.
Oh, wow.
Yeah.
I changed from, policeman to, firefighter to jet pilot. Now I'm running a pharmaceutical company, but I wasn't really good in science, which now I regret. I'm like, I wish I studied more science, right? But,
it's never too late. You could go back to like me and get more letters after your name. But.
Well, talking to people like you and working with people, making other cat therapeutics, as I mentioned earlier, I'm learning that way. I think that's just good enough for me right for now.
Yeah, it's plenty.
It's plenty.
Yeah. No, I did take a detour when I was a kid. Like I said, I have no memory of wanting to be anything other than a vet. Even in high school, all the way through high school, when I got to college, I realized how long of a journey it was going to be. 4 years of college and then 4 years of veterinary school, and started feeling like that was a lot of, tuition and a lot of time. And I wasn't sure I really wanted to do it. I also had a chemistry class that was really challenging and started feeling like, if this is the beginning, is it going to get too hard? Which is not a great mindset. I guess I could have had more faith in myself.
Back then.
Yep. Yes. Now I would counsel anyone to just, if it's really what you want, keep trying. Anyway, so I switched gears. I figured I would be an animal lover who had plenty of pets, but do something else for a living that wasn't quite as much school. And I got a degree in sociology and French, which turned out to not be instant job degrees. You know?
I'm sure it will be, you know, or you know, you might, I don't know, you might go as an ambassador to France,
Maybe,
you know, as a vet ambassador. You never know, right?
Yeah, I'm sure there's a niche for someone with those degrees, but I didn't find it. So I got a job as a case aide in social work and also a job in a vet clinic, just because I still had this piece of me that wanted to be involved, wanted to be around the medicine and the animals. And I would come home every day and I would talk about the vet job. I wouldn't really talk about the, you know, social work stuff as much. And I was trying to decide, do I go back and get a master's in social work, or do I follow this dream that felt so challenging and so out of reach? And again, if you know, as far as my parents, they definitely were like, look, this is your passion. This is what you want to do. It is going to be a long road. You are going to have to take loans out. It is going to be work, but it's what you keep talking about. So again, I think I was really fortunate that they didn't just say, be practical, you can get this job. You know, they wanted me to be happy, and they saw what I was passionate about. So I went back to school, took all the courses in undergrad that I had not taken when I figured I wouldn't take this path, and applied to vet schools and got into UC Davis. And did it.
I recall that your mother is a very impressive person too.
My mom is a very impressive person.
Yeah, I stories on working on a ship, right?
Yeah.
Could you share?
Sure. I mean, she could tell it better, but so my mother was born in 1932. So opportunities for young women were really different, obviously.
Sure.
She had a twin brother. Opportunities for men and women were really different. I think they were both really interested in travel and curious about the world. He joined the military and was able to travel that way. She ended up getting a job scrubbing decks on a Norwegian freighter and started. Could
you say
travel.
That one more time?
I know. Yeah.
She was a what?
She went down and got her Siemens papers and got a job on a Norwegian freighter, mostly scrubbing decks, cleaning the mess hall, or the kitchen. There's a name for a kitchen on a boat that I can't remember.
Catering. No. The canteen.
Canteen. It is the canteen. You're right. Yeah. So just labor, anything she could get to get herself out there and travel. She was pretty bold, I think, and pretty stubborn. Still to this day. Love you, Mom. She knows.
She's watching this podcast, by the way, right?
She might. You never know. I won't say anything too revealing. No, but so she did that. She worked hard, and she, again, she wasn't afraid of hard work. She knew what she wanted. So she did that, eventually made her way to Europe, with various twists and turns, and stayed. Got a job in Paris teaching English. She taught at the Sorbonne. She just opened doors for herself, I feel like, and was willing to work hard again. So that's where I ended up studying French in college. Is my mother has this history of living in France. She lived there for quite a long time in her 20s, came back to America, but then took us there. And we lived there for a little while when I was 13 and 14.
So, and you two live and travel to France quite often. I mean, I recall you were on vacation in France too. Yeah, I just went there.
Yeah, I guess I wouldn't say often anymore, just, being busy with work and so on. I don't go frequently. The last time, so I was just there last month. And I think the time before that had been maybe 3 years prior. So,
okay.
But my parents used to go, they used to spend anywhere from 4 to 6 months there after they retired. And my mom who is, she'll be 94 next month, but she just went there with me and spent a few weeks there. A lot of her good friends are there and professional connections. So she's got a whole life and community there.
Oh, wow.
And I have some friends there from the time that we were there. So it's nice to go back and visit.
So do you enjoy traveling?
I do. I love travel.
Okay.
Yeah.
You've traveled to Asia, right?
I have traveled to Asia twice. Yeah, twice.
And which two countries have you traveled to?
So I went to the Philippines. I went to go scuba diving in the Philippines.
Oh, you did you? Oh, okay.
Mm-hmm. That was pretty cool.
When was this?
This was in 2019, I want to say, because I think it was right before COVID.
Okay.
So I went and dove, essentially. I didn't see much of the country. In retrospect, I know the ocean floor there better than I could have probably seen a little bit more.
Well, you went there for a purpose.
I went there for a purpose.
Yes.
I fulfilled the purpose. But the other time I went to Seoul, South Korea.
There you go.
And met you.
Yes, we did.
Yeah.
We had a good time.
We had a very good time.
It was a group of people, and
really nice people. Yeah. All connections that you had.
Well, so can you tell me about the Korea trip? What was Korea what you expected to be?
To be honest, no, yes and no. I didn't really have expectations. I hadn't, it honestly wasn't so much on my radar as a place to visit. I have a long list of places that sound appealing, and I just hadn't thought of it. I don't think I knew too much about Korea. I think in America, we don't always learn as much in our geography and history as we could. So I wasn't super familiar. I knew it existed, but didn't know a lot. Didn't have any negative impressions, but no real highlights either. But I did, once I started thinking about going, I imagined it as kind of like a big, crazy city, maybe like New York or, I don't know, everyone in a hurry, large metropolitan.
There are places like that. I just didn't take you there.
Okay. I missed that part. Yeah. So the trip itself, it was amazing. I would go back in a heartbeat. It was a bit of a whirlwind. We showed up, I think I arrived late Saturday night, and then left the following Thursday.
I think we were there. I think you were there for 3 days. It was a very short, concise trip, but
we packed it full.
Yes, but since you work at UC Davis, the #1 vet school in the United States, how was your experience visiting some vet schools or vet clinics in Korea?
They were actually super impressive. We went to, as you recall, a really large vet clinic that was beautiful, super modern.
Right. I was impressed, actually.
I was really impressed. I was a little envious of some of their equipment. They had, in the bottom level, they had a swimming pool for physical therapy as well as a recreation for the dogs. They had CT scan, a blood donor ward, really high tech, clean, beautiful, friendly people. The doctors were amazing, welcoming, wanted to chat, wanted to know what my practice was like. It seemed like a great place to take your pet.
And they had on the top floor an acupuncture clinic as well, right?
Yep.
I remember seeing that, and I was like, I think Ilana would be very interested in talking to them, right?
Yep, yeah, I would love to.
Yeah. And you also had the opportunity to go see a cat supplement manufacturing facility as well.
Yeah, that was totally new to me. I'd only seen anything like that, on TV, on some kind of documentary. So really interesting. I learned a ton. I've never been part of watching a product get made or come to market. And so, I took food safety. You have to be a vet.
Sure.
And, microbiology. And I know, the basics of what makes a food shelf stable or not shelf stable. But watching them and watching their quality control and, again, thinking of things like, oh, that's right, they use heat to process that. So probiotics, for example, aren't going to survive, was sort of a very cool and interesting process for me. And just neat to see something new. But it was pretty cool. We got to put on the hats and the booties and the gowns, the PPE, the whole outfit, and go through and watch them both manufacture and package the product that they had on the line at that time.
Yeah.
So that was neat.
So one of the things I'm trying to do is manufacture already products that are popular amongst dogs and cats in Korea and try to present them here and make them available in the United States. And, please stay tuned. And if I need advice, I will definitely reach out to you for more advice.
I love giving advice.
Yes.
Yep. About cats anyway. Yep.
Definitely about cats.
Yeah.
And, during your time in Korea, we went out to a couple of restaurants, right?
Yeah. The food was so good.
Yeah. What was your favorite restaurant or dish?
I think the highlight, and I know you took us to one of your favorites, so I can't assume that they're all quite this good, but I think one of the highlights was the barbecue place you took us.
Sure. Yeah.
It was like you had a little hot stones or whatever, hot barbecue, charcoal.
Yeah.
Is that what it was? At your table. And so you could make the meat as done or as not done as you wanted.
It's a miniature barbecue.
Yeah.
You know.
It was great. And all these veggies. So tons and tons of veggies, which I really like vegetables and delicious meat. I'm a little picky when it comes to meat. I was a vegetarian for a big chunk of my life. So I do eat meat and I enjoy it, but I'm not like the most experimental meat eater. Mm-hmm. So when I travel, I'm always like, okay, I want to experience the culture. I'm willing to try anything. You know, I may or may not, it may or may not be my new favorite, but that stuff was all really good.
Well,
all
thank
of it,
you.
All of it. Yeah.
Well, but please make sure that's not your standard. I mean, I did take you to...
It was not, yes. But we also ate at a supermarket at like the deli counter kind of thing.
Yes,
so that felt really normal. That felt like on my lunch break, going to Safeway or whatever and going to their deli and grabbing food. That was also super good. So I feel like you definitely took us to some nice restaurants, but we also had, I think, we stopped at a gas station once and got a little packaged meal.
Yes, we
also
did.
good.
Yes.
So I don't know. I like what Korea had to offer.
Yeah, Korean food's good. Food's good. And I'm planning to do a podcast actually at that restaurant.
Oh.
So, my podcast is all these guests, but in between I'm going to have, just a session about Korean restaurants. So there's about 20 other restaurants around my office that I go to that I really enjoy, and they're very different types of food. So we'll have a podcast, and stay tuned. And when that podcast comes out with the restaurant that I took, you'll be like, oh, I know that place, It was great.
And wasn't it like the butcher owns it, or it's owned by someone who knows a lot about the quality of meat and all that?
The owner used to work in a meat packing company, and so he knows where all the... Well, I'm assuming he knows where all the good meat comes from. So
it seemed like it.
It was an amazing meal, right?
Yeah.
And besides meat, some other popular dishes. Since you like vegetables, I think you enjoyed bibimbap too.
Yep, bibimbap. That's good. I like that because I do love vegetables, and sometimes when you eat out, the veggie portions are smaller, so it was nice to be able to feel like I was getting good, healthy, and also yummy food. And I'm also not the most spice tolerant, like when it not spices like flavor, but like heat. Mm-hmm. I like it, but I can't tolerate a ton. So it's nice that you can say like, please keep this mild, and they'll modify, and then you can kind of make it what you want. If you aren't into pork, don't put pork in there. You like an egg? I like an egg. Put an egg in there.
Bibimbap is one of those things that you could customize it. When you're completely vegetarian, or you want meat and really spicy. So it's always a safe dish to have.
Yeah.
Do you cook at home as well, or since you love good food, do you cook good food at home?
No, it's really I don't cook good food.
You're too busy. You're too busy.
I'm busy, but also I just never cooking never took off with me. I like baking.
Oh, okay.
Yeah, my husband was the cook, and he used to cook delicious food for me, and now I cook really simple food. Like I try to make it healthy, but I don't. That's not my talent.
Okay.
Yep.
But when you go home after a long days of work, when you go home, you go back to your cats, right?
Yep.
You have 3 cats, if I remember.
I have 4 cats.
4 cats.
Yes.
Wow. Yep. And they are, what's their names?
There's Dot Dot, there's Pipsqueak, there's Willow, and there's Daphne.
Okay.
Yep.
How did you name the first 2?
So Dot Dot has 2 dots on her nose. She's descriptive.
I see.
Dot.
Okay.
Pipsqueak is, although I adore her, she can be a little of an irritant at times. Like she just makes herself known. She's the loudest. She's the most.
I'm here.
Exactly. Yeah. Okay. She's just a little Pipsqueak. She's got her opinions. Willow actually came to me with that name, but it fits. She's pretty. She's gentle. Yeah. And then Daphne is, you just asked about the first 2 cats' names.
Well, no, that's okay. Even Daphne.
I'm going.
I'm interested in Daphne. Daphne got her name, or did she?
Yeah, Daphne. No, I named Daphne. She, so she's very pretty also, I think. I mean, all cats are pretty, but she's sort of a fancy looking girl. She's got orange fur. And I remember Daphne from Scooby-Doo comics. Did you ever?
Oh, yes.
So she's the kind of fancy redhead.
Sure.
So I figured that matched.
Was Daphne the redhead with always a purple dress?
Yep.
Okay.
Yeah. Yeah. I really should have named Daphne Begonia because she keeps eating my begonia plants, or she's Daphne.
She's Daphne.
Yep.
Okay. And did you adopt all four, or?
Yeah, they all came to me through various, like Willow, I was working at a spay-neuter clinic, and she was one of the cats getting spayed there, and I just liked her. I bonded with her, and she needed a home, so I adopted her. Both Pipsqueak and Dot Dot come from a faculty member at UC Davis who does a huge amount of work with saving and rehabilitating and finding homes for kittens and orphan kittens. And yeah, she's amazing and works really hard for these little guys. So she tends to have cats who need homes, and these two were a match for what I was looking for at the time. And then little Daphne was a little bit of a unplanned adventure. I was actually doing another hobby, and the person I was doing it with, I was doing some stained glass work, had this cat.
Stained glass?
Yeah, so I like working with glass as well.
Okay.
Yep. And Daphne was there and needed a home, and although I had three... You
had a weak heart. You're just like,
weak heart. I pushed the limits. Yep. And Daphne came home.
Okay. So when you go home, are there any cats that come to the door and greet you, or
all four of them?
All four of them.
Yeah. There's a lot of screaming. There's a lot of running. I can actually, in the summer when it's warm, I leave the window open, so that I can see them as I drive up. They're sitting in the screen. And then you see their little mouth open, and they run to the front door. And then by the time I get to the front door, they're there.
Oh, that's awesome.
Yeah.
Great. So sometimes when I have guests over, I ask them, like, what are some unmet needs for cats or dogs or whatever pet you have? I mean, you want to take care of them. I mean, they're your child or your children now, right? And what are some of the things you do at home to make sure that they're healthy? I mean, but this question would be very different because you are a vet,
yeah.
I guess, right?
I'm a vet. I'm a cat lover.
Yeah. How do you take care of 4 cats?
Well, I will say that what I've done is somewhat ill-advised. You should probably have more space than I do for 4 cats. So I built a Catio, an enclosed structure. Yeah.
Oh, wow. It's a patio, but I guess.
Yeah, it's like a wooden frame with chicken wires type, to keep them in, because it is somewhat dangerous for them to be out in the world. We do have coyote not too far from where I live, and obviously cars and dogs and everything else. So, and then cats too can be, they kill songbirds. And so ideally, although cats would prefer to be outside and they'd probably be the happiest, it's nice to give them some exposure to outside.
Sure. Okay.
So, and that also expands their range within my home, so they each have like a place they can retreat to. Mm-hmm. So keeping cats happy, making sure they have an environment that is what we call like enriched and interesting for them. Sure. They should have like cat trees to climb up on and sit high. They should have little hidey holes down low. Some cats like to be up high. Some cats like to be down low. Toys, shifting toys, not just the same toy for 10 years. There's all kinds of little tricks you can do to keep them engaged. A bored cat is an unhappy cat. And
I have this little feather thing that I play around, and they jump. They jump really high.
I know, cats are crazy athletes. Can you imagine just like levitating up to the level of a counter?
Sure.
Like twice your height. Just whoop. Yeah, they're pretty amazing.
I know, right? And the cats have their own space, like they like corners and what have you. Yeah,
Pippi is not a fan of other cats, which is, again, it's on me. But I've given her a lot of space where, she has what she wants there. And they all have their whole run of the house in the Catios, but they sort of choose different areas. And then the other 3 get along pretty well. So
I was told that most people have 2 cats at least, because just having a cat alone, he or she might be lonely. Does that make sense, or is that true?
Oh yeah, I think it's a falsehood that cats are independent. I mean, they're independent in their way, but they're very social animals. Mm-hmm. They just normally in nature would choose their companion. And we sometimes, like I have done,
Just force them to be together.
Yeah, I say, well, you're all siblings now. You're living together. And so, they didn't get to decide. So, but cats do need companionship. So if you're home all the time, it doesn't have to be another cat. It could be you. If they get along with a dog, like I used to have a dog and Pippi was best friends with the dog.
Oh, really? Okay.
Like I think would follow the dog around, would climb in bed with the dog. So they all want their companion. And if you have two cats that get along well, that's great too. But alone is, if you work a lot, travel a lot, your cat needs someone there with them.
Sure. And since you're a cat expert, or you love cats, have you seen the amount of people adopting cats growing? I mean, I always felt like dogs were really the more favored pets, but
yeah, it's the typical debate. Are you a cat person or dog person? And it's like, I think people assume
Matt at this studio is a dog person.
I know,
by the way. Which is okay. By the way, I'm a cat person, so
we're tolerating Matt over there. He's keeping quiet. No, I mean, dogs and cats are both great. I love them both. They're very different, companions. I don't remember your question. What was it?
No, so do you see cats, the population or people adopting more cats than dogs, or can you eventually see people having more cats than dogs, or is there a upward ticking trend of people bringing their cats to clinics?
Yeah, I think so. So I think it's a couple things. At least here in California, housing's super expensive. So people might have a smaller space, maybe an apartment. If you're younger, maybe you're not settled in one place, and you're going to be moving, and renting with a big dog is not always easy. So a cat is an option for people.
Sure.
I think as the veterinary community, we are trying to get the message out that cats need regular veterinary care too. Like I was saying earlier, it's not uncommon for someone to come in with a 10-year-old cat and say, he just never had a problem before, so I didn't bring him in. And we want our pet owners to know that, we still want to check in on them from time to time. There are things that aren't obvious on the outside that we could potentially identify and get ahead of a disease before it's a real problem. So I think that message is getting out, and more of our cat owners are coming in for regular checkups or know what to look for if something's wrong. Cats are masters at hiding disease. So people are learning more and then wanting to help their kitty and coming in.
And I noticed that there are some people or some vets who specialize only in cats, right? Or they're building clinics out just for cats and making separate rooms. And I think what you mentioned about the accreditation, right?
So there are cat-only clinics, which is fantastic.
Okay.
It's, for the cat, the trip to the vet is nightmarish, right? Every once in a while, there's a rare cat who's so solid, but even those cats are creatures of routine. Dogs love to jump in the car, go on a walk, whatever. The cats want to stay in their territory.
Sure. Yeah.
They want their known environment, and they don't typically ride in the car. So unless you've done a great job of getting them comfortable with that, now they're in a box. Now they're in this weird, loud moving thing. Now they're in a building that smells probably like anxiety and has predators walking right by them. So going to the vet, obviously, and then you got me, the vet, who means well and loves them, but they don't know me.
They don't know who you are.
And I might have sharp needles in my hands. So some clinics have, there's just cat clinics. So you cut down on all the noise, all the different smells, you have people there who obviously love cats or they wouldn't have taken this job. And so they have a special interest and potentially some special training in handling cats. Or if the clinic is both dog and cat or multiple species, but they've taken care to make it more cat friendly, there's actually a cat friendly practice certification that clinics can get. And then there's low stress handling and fear-free certifications to help the cats be as comfortable as possible. And that includes things like a separate entrance and waiting area so they aren't mingling with the dogs, exam rooms that no dog is allowed to enter so we don't get the dog smell, and people who are trained to handle them differently, make the room quiet, have something soft on the table so they aren't plop down on a cold metal exam table. All kinds of things from like the smallest, just having a blanket on the table to knowing the special, medical needs of cats.
Wow.
Yeah.
I have 2 cats. I feel like I should invite you to my house and you could help me set up things.
I would love to.
Wow, I'm surprised. I mean, I never thought of all the things you just mentioned. I should definitely take that into consideration and kind of rearrange my house a bit.
Yeah, a lot of it is seeing, we have a tendency to anthropomorphize our pets. And again, like you mentioned earlier, sometimes we see them as children, and that's great. They are family members, but they aren't human. And so while a lot of things translate from one to the other, there are needs they have that we might not think of until someone points it out. Everything from like where the litter box is positioned, to how many litter boxes you have, to what kind of food they eat, and what it looks like when they're in pain isn't always obvious until someone tells you.
Sure.
And then it's like, oh, right. Okay, that makes sense.
But in order to keep a healthy cat, right, just like humans, I mean, you would need to eat well, but people, we rely on supplements. If we're in pain or if we have any diseases, we would go to a doctor and expect to get some kind of prescription. I noticed that there are various health supplements or medicine for dogs, but I don't really necessarily see that in cats too much. Would you agree? Yeah,
there are a few for sure, but like if you go to your average pet store, there's like shelves and shelves for the dog and like a little corner for the cats. And again, it doesn't always translate. Sometimes you can give a cat dog stuff and sometimes it doesn't do what you want it to do, or maybe it's not even healthy for them to have it. If you're choosing a well-formulated cat food, it should be what we call complete and balanced. So it should be something that meets all their nutritional needs. But there's a ton of pet foods on the market. They aren't all perfect. Some are better than others, depends where you're shopping and what you're getting. And it also depends on your cat's needs. Does your cat have sensitivity to certain foods, or does your cat have a medical condition that might increase its need for something? The B vitamins, for example, some cats have digestive issues and actually need supplementation, even though there is B12, B6 in their diet. That's just an example. Probiotics, keeping the gut biome healthy. So there are supplements for cats. There's room for medication and supplements for cats that could just enhance their life, even if you're doing a great job.
Well, as somebody who works in the healthcare industry, and we do manufacture health supplements for humans, I am very much interested in making more health supplements available for cats. And I realize cats are not humans, so you have to understand the physiology and all, and when you're making a product. So I'll definitely ask you for some help.
Happy to share.
And tell me what you think might be beneficial for cats. I'd love to hear your thoughts on that.
Yeah, when I think of sort of like I guess I would call them underrepresented areas of cat health, it doesn't mean that we aren't aware of them or working on solutions, but they're tough solutions for whatever reason. Things like dental care for cats.
Sure.
We counsel everybody to brush their pet's teeth. We are also 100% aware that brushing your pet's teeth is not straightforward and may not occur as... It
actually might hurt too.
Well, you and them.
You and them,
yes,
correct.
Yes. Right? So if they don't want you to, it could hurt you. If you are, in too much of a hurry, it could hurt them. So it's not simple. We ask you to do it as the veterinary community. We understand it's not as easy as like giving a treat. So there are dental supplements. We could have more dental supplements because each cat has different preferences. So they may not like the one that's on the market that you bought. B12 I mentioned. So as cats age, we now know, and there's studies coming out in all of medicine all the time that expand our understanding of physiology. But we know now that as cats age, they have potentially, some of them, an increased need for some of the B vitamins.
Like there's, cats were originally meant for, catching rats or rodents, right? And now they're all domesticated. So I was told by some people that there's certain vitamins or certain nutritions that you used to get from catching prey that they don't get in today's world. So that's why that cats need supplements. Would you agree on that? Or you need to find ways to replenish their supplements, which they don't get from what they used to get it from catching rodents.
Yeah. So again, if you are feeding one of these complete and balanced, like AFCO, tested foods, you're probably covering your bases pretty well. Mm-hmm. Having said that, again, your cat may have a deficiency or a disease that causes it to have a deficiency. But they are, as you mentioned, obligate carnivores. So they don't make some of the amino acids that you and I or dogs can make. We eat a protein, we break that protein down into amino acids, and then we rebuild it into what we need, is sort of the oversimplification. Cats can't necessarily do the rebuilding part for some amino acids. They have to consume them. So, which is why you'll hear cats can't be vegetarians. There are things like carnitine and so on.
That's true. I did hear that cats cannot be vegetarians.
Yeah, can't be vegetarians. Also can't be exclusively fish eaters. They can eat fish, but they can't be on an only fish diet, or they'll be deficient in thiamine. So one of the biggest concerns is that they get their amino acid profile. Mm-hmm. They require, or they thrive. I mean, you can survive and then you can thrive, but they need different protein to fat ratios than dogs, for example. And it does boil down to, this is an animal that was probably going to eat mice, birds, animals that are mostly muscle and bone, not a lot of fat, not a lot of carb. They eat carbs, but they don't have the same requirements as you and I do. And our kitties are living longer thanks to good care, and we want them to live longer. So in the time frame that, you might have a cat, my first cat lived to be 21. That's not super common, but 15 to 18 is, I think, a great expectation for a cat. And over that time, we might have to change their nutrition, their water consumption. Yeah. And
so when I look at the cat supplement landscape, right? I mean, you mentioned dentals, and we talked about vitamins. I also noticed that there are products, up and coming products related to calming.
Oh, yeah. Well, again, some of that goes back to what I mentioned earlier about we take cats who are animals who would typically select their companions and move in if they had all the room available to them, move away from those individuals that they don't vibe with. Mm-hmm. And we put them in our house or our apartment, either by themselves or with animals that maybe they didn't select. And potentially with all kinds of noises and movements that aren't comfortable for them. Mm-hmm. And cats are really prone to stress, and they do manifest some of their stress physically, like we do. We have some physical ailments that are linked to stress. And stress, like when I say stress, I think sometimes people think that we're stressing the cat out, like we're harassing them. Stress for cats could be construction in the house next door and they can hear it, or the dog barking in the house next door, or you going on vacation. And all these things where sometimes people think, oh, I go on vacation, my cat was angry, so he peed on my clothes. He probably wasn't angry. He was probably so distressed. And this was one way to
relieve his stress.
Yeah, manage his feelings.
Manage his feelings.
Yeah, yes. Exactly. Or cats can get inflamed bladders from stress, cystitis, and maybe they were feeling that. So managing stress, especially given that we take cats and put them in our environment, myself included, cat vets included, anything that can help them manage that stress, calm them, is welcome. And it's a difficult one.
I should make a anti-stress product for cats and maybe take it myself.
Yeah. If it works, I'll take some too. Yeah. Okay. Stress is an epidemic. Anxiety.
So some people ask me if there are stress supplements for cats, which I'm looking into, and also digestion, right?
Yeah.
That's also an unmet category, I was told. Is that?
I would say so. I think we have some very frustrating diarrhea cases, especially in kittens, where we haven't identified necessarily one culprit. It's not, it's this virus, and we just, sometimes we can identify either parasites or, other infections, but often it's sort of a watch and wait, give them high quality nutrition, and they will hopefully grow out of it. Some cats have distinct nutritional needs like food allergies or food sensitivities, or again, as they age, their absorption of nutrients can change. So again, these B vitamins can be really helpful. High quality protein is really important. Choosing a food that has been, well crafted with a lot of research behind it is important.
So they do diarrhea because the imbalance of nutrition, or?
It sort of depends. I mean, sometimes diarrhea itself leads to imbalance, but they can have vomiting and diarrhea or one or the other from absorption of nutrients or the differences in how they absorb the nutrients or malabsorption. Okay.
One thing I occasionally, because I have 2 cats, I'm just curious how cat food tastes like. So
you haven't tried it?
Occasionally I try it. Yeah. But one thing I noticed is it's not sweet. Supposedly cats cannot or shouldn't eat sweet things. Is that correct?
They don't really have the receptors for sweet like we do. They might go for sweet, but let's say you have ice cream. The cat might be really into it. They're probably after the fat content. So if you give them some kind of candy or, yogurt, whatever, they're probably not there for the fruit flavor or the sweet flavor. They're probably there for the fat and maybe some protein.
Interesting.
Yeah.
Because, another thing with that, I think that's very important is it's not only the fact that you want to make nutritional or, balanced products, but it has to be palatable.
It has to be palatable.
I mean, you might be the greatest thing in the world, but if the cat doesn't eat it, it's very frustrating.
It's a huge problem. Yeah. And it's the same with medication. A lot of medications are bitter. Cats are super sensitive to bitter, like hypersensitive to bitter. So we have to mask those flavors with something else, or find flavors that they like. And it also, some of this goes back to them being kind of creatures of habit, where they find something they like, they find it safe, they will stick with it. And so if they've never had it before, it could be something that needs to be introduced to them really slowly, or, play little food games to get them to try it. They also don't have as many taste buds as we do, period. So the taste matters, like bitter is bad. But the smell is really important. Cats navigate a lot by smell.
So in terms of smell, and I had this kind of maybe preconception, but I always thought they liked fishy smell.
Sometimes they do. I will say I bought these little freeze-dried minnows for my cats, and 2 of them love them. 2 of them will not touch them. One of them does the thing where she scrapes over them as if she's like, it offends me. I must, yeah. So I think it just depends on the cat. Fish, cat, sure. A lot of cats do like fish, but some of them don't enjoy that.
But I noticed that actually chicken is very popular.
Chicken soup seems to be a flavor they really like.
Yeah.
Some cats are sensitive to chicken and shouldn't eat it, but a lot of cats do like a chicken flavor, beef flavor. Yeah.
And another thing that I'm looking into is making medication or drugs or drugs for cats, and making a drug that's palatable is challenging. So rather than that, we were thinking of perhaps making biologic drugs or injectable drugs. It's probably easier. Would you agree that would be a little bit more convenient in terms of medicating cats?
Yeah, yes and no. From my perspective, yes, it bypasses the whole will the cat get it. So many times we send medication home with owners and it just doesn't get in the cat despite the owner's best efforts. And then we also worry about the human-animal bond and your relationship with your cat. And has the cat started hiding under the bed when they see you because they associate you with
giving pill?
Yeah, trapping them and shoving something down their throat. So it's not really worth it if your cat is healthy but hates you and your whole relationship is about anxiety and fear. So if we can bypass that.
Yeah, quick and simple injection, right?
Yep. I will say the only downside is that depending on whether it's an injection that can be given at home or not, people might have to bring their cat into the vet to get it. And some people aren't comfortable with needles, and so they might not be comfortable giving it at home. But I found with pretty much all my clients, if they do need to give an injection of some kind, once we show them how and get them comfortable with it, it's really not that bad.
Okay. Well, especially with all these GLP-1s now that people are self-injecting.
Yeah, I guess people are getting more comfortable with medications and they come with a syringe. Yeah.
But I know. So again, we're looking into that. But I do believe still that perhaps medicating cats by a professional might be better in the beginning, but I guess it might change over time. I
think it is changing, and I think we're seeing more. Like with the monoclonal antibodies, we're seeing more injectables both for dogs and for cats. And so we're seeing the advantage of that. So
are the current drugs for dogs and cats that are biologics, are they self-inject, or do they have to come to the clinic and the clinicians or the vets inject the medication? I think so. Where I am in the primary care service at UC Davis, we would administer, let's say, the Silencia, which is a drug for arthritic pain in cats. Yep. We would give that and ask you to come in. And some of that is to check on the progress and how it's going and check in with you. I think there are clinics that script it out for people. There's no, it's not a controlled substance. Sure. So I'm not going to send you home with, 5 labels of buprenorphine or, anything like that. But it could be dispensed to the home if you felt comfortable that the client can give it correctly. It's not going to be a drug of abuse. So I don't see how, it could be diverted or misused. Sure. But I think sometimes we just want that veterinary oversight to make sure it's being given correctly and that the animal's responding to it well. Well, like I said, I have many ideas of making supplements and medicine, and it's nice to actually have you as somebody I can go to and ask some questions and advice. So I look forward to doing more of that in the future. I guess one last question, something separate. What has the cat taught you about life? Oh, many things. I mean, like I said, my first cat was with me for my first 21 years of life. So sure, I learned a lot from her. Many lessons. I think probably the biggest one that is most applicable to all areas of life is that there's always a different perspective. So earlier I was saying how often someone will feel like my cat was mad at me and so they urinated on my clothes. Your cat probably wasn't mad. Your cat was probably having tons of anxiety and this is the way they acted. And humans are just the same, right? Fear is often masked by anger. So I know for me, sometimes I'm upset. And when I really sit down and think about it, what is going on? What is triggering me? What's upsetting me? Oh, I'm scared about something, or I'm confused about something. And so animals too, their body language and their behavior isn't always easy to interpret. But once you learn about it, you understand them in a totally different way. So I feel like keeping your mind open to maybe there's another explanation, maybe there's another perspective. So I'm a work in progress with this all the time. But just trying to remember that everyone has their own story and cats definitely have their own story. Sure. and cats are not dogs. Yeah. Cats are definitely not small dogs. Just trying to see it from standing in someone else's shoes. Yeah. I really particularly appreciate my cats. I would have a stressful day. They would come in front of the door and I could get meow, and I'd give them a hug and they purr, right? Oh, the purr. And once they purr, that stress or that thing that was bothering me kind of just disappears, right? Yeah. So I'm really thankful for them. As much as I enjoy raising them and taking care of them, I appreciate the fact that they do kind of alleviate some of the stress that I have during the day. Oh, yeah. And that purr is the best, that vibration. It's I think it does something to our nervous systems, something good. We should do a clinical study on that. We should. Yeah. Do you, by the way, someone may have. I believe I was given a clinical study or a paper about that. I haven't read it, but I should definitely double check. Yeah. There's something about the tone and the resonance and our cortisol levels, I think. But cats also know how to relax. They sleep a lot. They do sleep a lot. We could learn that from that. Take a break. I guess they just don't have a lot of homework. That's why.
Yeah, they don't take their work home.
Actually, a question. Do you do clinical trials?
I don't run clinical trials. I help with some of our faculty who are doing studies with recruiting individuals. Sometimes it's just recruiting the controls, the normals, because I see normal patients, whereas in the tertiary care facility, often it's just sick pets. But in primary care, we'll see healthy animals. So sometimes I'm recruiting healthy animals to work as controls in a study.
Okay.
And sometimes I am helping recruit individuals who have, a condition or criteria that help them fit into a study. So I'm not running it, but I am involved in sort of helpful ways. I hope helpful ways.
Sure.
Yeah.
Okay. Great. Well, thank you very much, Ilana. This was great. I've learned a lot. Thank you for being on my podcast.
Thanks for having me.
Yes.
It's fun to talk about cats and food.
Yes, it is.
Things I love.
Yes. Well, if I have other things that I will be introducing in the United States, I'll be definitely sure to ask your opinion.
Okay.
And for everybody else who's tuning in, please subscribe to my podcast. And it was great for all of you to join me with Ilana. So thank you.